Welcome to Adapt NCLEX. Are you ready to pass your NCLEX? This is a video 85 English practice question, English review question, English practice test that will test your knowledge, will challenge you to get ready for the NCLEX. And if you worry about the new test plan, what the test is going to look like in April 1st, don't worry. I've used some of the language. I've sprinkled them throughout the test, and I will show you when we get there. You will identify them when you see them, and I will tell you what you need to do for me. Grab a pen and paper, stop the video, answer the question on your own, keep track of your score. And at the end, I want you to achieve more than 65. If not, keep on watching it and you get there. Are you ready? Let's get to it. First question, what do you see? Pharmacology. And this is providing teaching to a client prescribe what? Pravastatin. Don't worry. If you can't recognize it, it's okay. Which of the following instructions should the nurse include about when to take this medication? Teaching associated with pharmacology. Take the medication in the morning with breakfast. Take the medication at bedtime without food. Take the medication with or without food before bedtime. Take the medication before meal on an empty stomach. There is a concept being tested, and I'm going to show you the concept. Stop the video, answer the question on your own, and pick your answer. After you pick your answer, this is the way I'll approach the question. I look at it. I've never seen what? Pravastatin, but I've heard the word statin. It sounds like statin. Okay, I don't care what is in front of it. Pravastatin, it means statin. Whatever you know about statins is the same thing. It's cholesterol-lowering medication, which statement indicate what? Instructions you should give to the patient. That means how did they take this medication? Number one thing you have to know, you got to take it in the evening. Therefore, morning gone. You can take it with food or without food. Therefore, I know I got to take it in the evening, bedtime. It does not matter whether you take it with food or not. Therefore, this is wrong. It said without food. That makes that answer choice wrong. And therefore, this is the best one. With or without food, you can take it at bedtime, and that is the best thing. Taking it after meal on an empty stomach, it does not indicate when you should take it. Don't pick number 4. It's a trap. So 3 is the right answer. Take it in the evening, but at bedtime, with or without food. That's the best answer choice. You recognize this question? And nurse is caring for several clients, which action demonstrates unbiased care and supports equal access to treatment. This is exact language the NCLEX put on the new test plan 2026. It does not matter. It doesn't, you don't have to freak out. It said unbiased care. Whatever you do in your clinic, in your hospital, the same thing. When you give care, there is no bias. You don't care about the age, sex, no matter what. And you provide equal right to everybody. So that's all. Therefore, assign client to a room based on the gender identity preference. Avoid discussion of what gender identity to prevent discomfort. Using the client preferred name and pronouns during care. Providing care only based on the biological sex documented in the chart. This is what they put in the 2026. You don't have to worry. It just means unbiased care. You treat them no matter their gender, their sex. Therefore, which one? Demonstrate unbiased care and support equal access to care. You can see whatever they want to be called, their preferred name and their pronoun, he, she, whatever they want, that's all. Here, if you assign them based on their identity, you would basically be biased. If you avoid discussing about it, it's the same thing. Providing care only based on that is a bias. Therefore, use their client's preferred name and pronoun. That's all. So don't freak out. It shows inclusiveness, respect, and unbiased. That's what they want to emphasize. That's the test. So if you're freaking out what is coming, this is it. It's just a language. This is the same thing. This is another language you put in the test plan. If you read it and you realize that you know everything that they're going to ask you. with action by the nurse best support maintenance of what? Client dignity. Are you telling me you're not been showing client dignity when you take care of them? You've been doing that. If you see the language, they just want to emphasize and put the language they're saying client dignity. It does not matter. And privacy, we've been doing that. A nurse is caring for a client who requires assistance with hygiene. What should you do to indicate client dignity and privacy? Close the curtain and complete care efficiently while limiting conversation. Keeps the client covered and explain each step before proceeding with care. Perform care with another staff member present to ensure safety. Prepare all supplies at the bedside before beginning care. Stop the video, pick your answer, and let me know. You can put it in your record and keep track of it. But which one indicates client dignity and privacy? When they give you this kind of question, underline the buzzword and focus on it. Client dignity and privacy. That means every answer choice you got to pick should reflect that. Close the curtain and complete care efficiently while limiting conversation. Is good, but it does not indicate client what? Dignity and privacy. You got to get the client involved. Dignity. Did you pick your answer? Keep the client covered. Explain each step before proceeding. You are involving the client, providing dignity, communicating with them. This is what dignity, respect, and communication means. Perform care with another staff member present to ensure safety. Yeah, but it does not indicate privacy and dignity. You are just protecting yourself. Prepare or supply at the bedside before beginning care. That is the normal practice. It does not reflect dignity and privacy. And therefore, it does not answer the question. And this is the right answer. That is the explanation. You can take a picture of it. But like I said, each question, stop the video. If we see a new test plan language, I will emphasize that so that you pay attention to that. When you're taking the test, do the same thing. And this one, it may trip you, but don't worry. If it trip you, I will emphasize the concept. Next time when you see it, you won't run away from it. A nurse is caring for a client who sustained a full thickness burn to the entire torso and superficial burn to both arms. Using rules of 9, what is the total body surface area burn? You have to calculate yourself. There's no answers, calculate it. And then put down your answer and see what you got. But I'll calculate for you. If you do rule of 9, the question say entire torso. Entire torso means your chest and your abdomen. And the back, it said front. Entire torso means front and back. When you say entire torso, you know the front is what? 18. And the back is also 18. And therefore, what are you going to get? 36. This is 36. That is what? Full thickness of the torso. Then there's a superficial bend to both arms. That's a trap. When you're calculating total body surface area or burn, I want you to write this down. You only deal with what? Full thickness and partial thickness. Look for that word, partial thickness. Don't include this superficial burn. Full thickness and partial thickness. I don't need to include what? Superficial burn of your hand. That means you got to include the whole the hands, which are 9. You should not include it. And therefore, all we have is 36. That's your right answer. So don't include it, just 36%, because it's superficial burn. Which of the following highlighted findings require further intervention? Select or apply. I'll make this test a little bit challenging as because I want you to pass it so that you can be ready to deal with anything the NCLEX will throw at you. A bunch of select or apply. When you're doing well, you see a bunch of select or apply. Like I said, this is a categorisms. That's why you see the test get harder and you see more categorisms. Therefore, select or apply. And I give you this. Don't worry. Read it. Client report low-grade fever. Okay. Malaise and pink maculopapular rash. There's a rash, right? That begins from the face. Then you go down, spread to the trunk. What kind of rash is that? I have low-grade fever, malaise, and I have a rash that starts from my head to down. Then I have posterior auricular lymph node. That means behind your ear, there's a big node there. The client is placed in a private room with negative pressure airflow. The nurse entered the room wearing N95. The nurse removed the gloves after contact with the client and performed hand hygiene. A pregnant staff member is assigned to assist with the client's care. The client is transported to radiology wearing a surgical mask. Did you see what is going on? This is infectious control. You have to make the diagnosis. Who has fever, malaise, pink maculopapular rash? That starts from the head to down. And they have big lymph node behind their ear. And the nurse is doing what? Wearing N95, taking care of that patient, washing their hands. Pregnant staff is assigned, and the patient transported to the radiology wearing a surgical mask. Which of the following highlighted require further intervention? That means something is wrong. Client is placed in the private room with negative pressure airway. Do you think that's appropriate infectious control maneuver based on the signs and symptoms I'm giving you? N95 masks when entering the room. That's what the nurse is wearing. The nurse performs hand hygiene after removing the gloves. And the pregnant staff member is assigned to take care of the patient. Is it appropriate? Client wear what? A mask during transplant. If you don't see what is going on, I'll help you. Low-grade fever, malaise, pink maculopapular rash that start from the head and go down, and the presence of posterior auricular lymph node. These four things make this is a rubella infection. So I want you to look at it again. Next time when you see rubella, you can find what it is. And you know rubella is what? Droplet precaution. If this is droplet, then I don't need a negative pressure room. The nurse does not need to wear N95. It wears surgical mask. The nurse should perform hand hygiene after removing gloves. That's good. Pregnant clients should never be assigned to a patient who has rubella. And when you're transporting a patient in a droplet precaution to the X-ray, they need to wear a surgical mask because this is rubella and it's very, very dangerous. Analysis, and it's received report on several client prioritization. Which client should the nurse see first? You got to be sharp. Who is in trouble? Divide the thing into two and see whose condition is worrisome. A client, 3 hours ago, right? Has headache, admitted 3 hours ago. All of them were admitted 3 hours ago. This patient has mean arterial pressure of 45. A client, admitted hospitalized 3 hours ago, and he has chest pain with the normal EKG. Another 3 hours ago, painful great toe. Which situation required for the nurse to assess the patient first? What do you think? Stop the video, pick your answer choice, but this is not my sis. We are keeping track of your record and see how you're doing. Prioritization, you got to be sharp. Migraine, this is mean anterior pressure. This patient is in shock. You have chest pain and normal EKG. I have time. You have painful gout, pain, great toe. I'm not worried about you right now. I'm worried about a MAP of 45 is low. That is shock. If I put blood pressure low, you're going to pick it. I intentionally put MAP of 45 to track you with the somebody with the chest pain. Remember, the EKG is normal. Therefore, MAP of 45, this patient is in shock. And this is caring for a client receiving IV fluid for dehydration, getting fluid for dehydration. The nurse suspects the client has developed Phlebitis at the IV site. This is pharmacology IV therapy. Which of the following assessment finding would the nurse suspect? Don't freak out. The buzzword, go for it, is Phlebitis. What do you know about Phlebitis? You have extravasation, you have infiltration, you have Phlebitis. Don't guess. Look at the answer choice. If it sounds like Phlebitis, What is it? Phlebitis, itis, something inflammatory, right? A cold, pale skin around the IV site, swelling and taut skin at the IV site, redness, warmth, and palpable cord along the vein, leaking of the IV fluid with no pain. Go back to the buzzword. What does that mean to have phlebitis? You pick your answer. I can tell you this is the right answer. What is that? Itis. I'm looking at itis, phlebitis, some inflammation. I should see red. I should see signs of infection or inflammation, warmth, and then the phlebitis is IV. Therefore, I should see a palpable cord along the IV line, which is the vein. Cold, pale skin around the site, there's no signs of inflammation, that infiltration. Swelling and a taut skin at the IV site, infiltration. Leakage of the IV fluid with no pain, infiltration. If there is necrosis, extravasation. Therefore, this is your right answer. This is another new language you will see on the NCLEX. Which statement by the nurse indicate effective handoff communication? A nurse is providing client handoff report to the oncoming nurse. Which statement by the nurse indicate effective handoff communication? Client is stable, continue carrying care. This is a 70-year-old client admitted with heart failure who is on what? Multiple medication. The client has heart failure, crackles in the lung, +2 edema. Monitor closely. The client is 72-year-old with the heart failure. Lung sounds reveal crackles. Oxygen saturation 90% on 2 liters. I recommend monitoring respiratory status closely. When you're doing handoff, when you're passing patient on, what kind of protocol do you use? That's all. That's what the question is asking you. Don't freak out. You use what? SBAR, which is what? Situation, the background, assessment, and what? Recommendation. ABC has no recommendation. This patient has, the last patient has recommendation. It gives you assessment, lung sound, crackles, oxygen saturation. It gives you the situation, 72-year-old patient. This patient is complete. The rest does not have all the information that you need. Look at it carefully. Every time you hear about handoff, think about SBAR. There should be a situation. What is the situation? What is the background of the information? Here is a 72-year-old admitted who has multiple medication. But I don't know. There's no assessment here. There's no recommendation. That's not a good answer choice of a handoff a patient. Which of the following findings should the nurse identify as concerning? Like I told you, these questions are really difficult, but don't just relax. When you see it in the NCLEX, I want you to take a deep breath. Take a deep breath. Click on the image concerning. Read it. These are highlighted information. And then look at the highlighted information. If it's worrisome, you pick it. It's a simple question. A nurse is caring for a client 24 hours after what? Right total hip arthroplasty. He has a hip surgery. The client is awake, alert, oriented. Okay. Lung sounds are clear and heart sounds are regular. Fine. Surgical dressing to the right hip is saturated. Oh, something is wrong. The client reports hip pain 1 out of 10. Okay. With the last dose of morphine administered 60 minutes ago, after they give the morphine, pain is gone. The client reports new onset pain at the right calf. There's pain at the calf, which is rated as what? 7 out of 10. The right calf appears slightly swollen, bigger than the left. Something is wrong. He has a hip surgery. Think about it. Put everything together. The client also reports feeling of what? The room spinning. Oh, there's a saturated dressing and now room is spinning. Am I bleeding? Fetal pulses are equal bilaterally. Decline. I don't want to walk this morning because what? I have pain and I remain seated in bed. Probably that's why your calf is what? Tender. He has SCDs in place in both extremities. Highlighted information. Which one? When you see this, you know what kind of question they can ask you. Which one is concerning? Okay. Right hip surgical dressing is saturated. Right hip pain. Room spinning. Calf pain. SCDs in place. I don't want to walk. What do you think? Of course, saturated dressing, I don't like it. If you have right hip pain, it's 1 out of 10. It's expected. Room spinning, you may be hypotensive. Calf pain, you may have DVT. SCDs is preventing DVT. If you're not walking, I don't like it. That's why you're getting DVT. Therefore, those are the concerning, like you said, highlighted information. This is the way the NCLEX will give you. What do you think? Infectious control. Which of the following require initiation of what? Contact precaution. Who need contact precaution? Select to apply. And next on the medical surgical unit is review report on several clients from emergency department who need contact precaution. You have to know the organisms and individual who need contact, airborne, droplet, all of them. If you need more, check adapt and class have a bunch of infectious control. But what do you think? A client with suspected C. diff infection and profuse diarrhea, what kind of precaution? Client with RSV and coughing. A client with what? Active tuberculosis and night sweat. A client with MRSA with a wound infection. And a client who has influenza and fever. Which one are contact precaution? Infectious control is big. Almost about, you're going to get about 15 questions from that, and safety. Therefore, you should master them. Clostridium difficile is what? Contact precaution. RSV is contact and droplet. Therefore, don't pick it. It's a trap. Don't. Active tuberculosis is airborne. MRSA, contact precaution. Influenza, droplet. So A and D are your right answer. And this is preparing to administer morning medication to a group of clients. Which of the following are included in the right of medication administration? Remember, pharmacology and IV therapy are big. 18 questions you may see. And therefore, don't just study pharmacology. Also know IV therapy. And this is one of the questions on medication administration. Right of medication administration. Right client, right documentation, right room, right diagnosis, and right refusal. Which of this do you think is part of the right of medication administration? What do you think? Pick your answer, stop the video, keep track of your record. But of course, we got to give it to the right patient. We have to provide right documentation. Your room number, it has nothing to do with the right. Your diagnosis, you can have chest pain, everything is not right of medication. You have a right of refusal. So right client, documentation, refusal, and your right answer. And next is caring for a client with what? Serum sodium of 125. Which of the following assessment findings should the nurse expect? Select or apply. 125 is low. Hyponatremia. Think about it. When your sodium is low, what do you think? Pick your answer. Stop the video before I give you the answer. What do you think? Confusion, seizures, active deep tendon reflex, muscle weakness, decreased dry, thick mucous memory, and what? Headache. You pick your answer. After you pick your answer, then you can listen to me. Whenever you see hyponatremia, low sodium, think about neurological problem, mostly number 1. And what is that? Brain is going to swell. If the brain swell, you're going to get confusion. You're going to have seizures. Your reflexes go down, not hyper. Is when your sodium is high, you have hyper reflexes. Your muscles are going to get weaker. When your sodium is high, you have dry mucous memory. They get thick and sticky like your tongue, and you get headache. Neurological problem. Neurological problem when you have hyponatremia. Even if you don't know, don't overselect. If you know only 2, confusion and seizures, pick it and move on. Therefore, those are your right answer. We are on number 13. How are you doing so far? Like I said, I'm hitting you hard, but I want you to master this. I want you to pass your hand because this is why this question look like that. But it's this concept you know, presented in different form. You know it already. What is this? Client is admitted to the medical unit with complaint of what? Severe intermittent headache. right? Palpitation, increased temperature, episode of what? Excessive sweating. These words, those are buzzwords. 5 things are put there. He has headache, he has palpitation, his temperature is high, and he's sweaty. The client report, I suddenly feel like my heart is racing and I get really sweaty for no reason. During this episode, the client blood pressure is significantly elevated with the reading as what? 210/110 and a heart rate of 120. Between the episode, client may say return to normal blood pressure. The client report weight loss despite eating anything they want. Is anxious, diaphoretic, restless. The client report weight loss despite normal appetite. Laboratory shows what? Catecholamines are elevated. And then you'll check their glucose, it's 250. You see something? Let me show you. I'll write it here. The 5H. You have headache, 1H, right? You have what? Temperature, hypothermia, sweating, hyperhidrosis, hyperglycemia, right? Those are all very, very important associated with this condition. And hypermetabolism, 5H. What condition is that? This is how you learn NCLEX. This is endocrine problem, and this is all the things you know is put in this case form. Which condition has 5H? Headache, hypermetabolism, hyperhidrosis, hyperglycemia, and hypertension. What do you think? That's all. Stop the video and answer the question. Therefore, which of the following interventions should the nurse anticipate in the plan of care? Administer beta-adrenergic beta blocker as prescribed, give them beta blocker. Low stimulation environment, monitor their blood pressure as once a shift, place the client in the Trendelenburg position during hypertension episode, and initiate aggressive fluid resuscitation, encourage frequent ambulation to reduce blood pressure. This is what we call Pheochromocytoma. This is Pheochromocytoma. If you don't know, check Adapting class, videos on that. But then, how do you manage it? Pick your answer, let me know. Stop the video. The first thing you do is not the beta adrenergic, you use alpha blocker first before beta blockers. You should give them low stimulation. Blood pressure once a shift is too low. The blood pressure is so high, you got to do it multiple times. If you put their head down, Trendelenburg position during hypertensive episode, you're going to kill them. Too much hypertension. They need a bunch of fluid. They are dehydrated due to the high blood pressure. And you should not let them walk because their blood pressure is too high. You don't overstimulate them. Therefore, initiate IV fluid and then low stimulation. This is what we call Pheochromocytoma, 5H, hypertension, which is episodic, hyperhidrosis, that's sweaty, headache, hypermetabolism, and high temperature. You initiate alpha blockers, hydration, low stimulation, then beta blocker, then you go to surgery. Write them down and come back for this. Number 14, and this is caring for a group of clients on medical surgical unit. Which of the following intervention demonstrate protection of client's rights? 2026 language right there. You know this and you can't tell me you are afraid of the NCLEX now. You should not be. This is all you do, protection of client's right. Which of these indicate I'm protecting your right? Disclosing the client information without consent, teaching the client about advanced directives, ignoring the client cultural preference, delaying the informed consent process. Like I told you, I sprinkled them throughout the video so that you can see. You see the language of protection of client's right. This is different language, but it's the same thing. Privacy. Which one I'm protecting your right? If I'm not disclosing your information I'm disclosing your information without consent, that's not right. If I teach you to take advantage of advanced directives, yeah, I'm helping you. If I ignore your cultural preferences, that's bad. And if I delay informed consent, therefore, B is the right answer. So these are little things you may see in the test. Don't freak out. You're going to do well. Which task should the nurse delegate to LPN? Delegation, NCLEX, right? Management of care. The nurse team is made up of what? You have LPN and UAP caring for several clients on a medical surgical ward. What should the LPN do? And I call it MMR most, right? Most medication, monitor, reinforce, stoma, special test, and what? 2 feet. That's all. Another clue is what? If there's a UAP there, whatever the UAP will be able to do, don't let the LPN do it. Therefore, which one? Provide client with what? Back massage, ambulate the client to the bathroom, perform client sterile dressing change, and check a client finger stick blood glucose. Which one would you give to the LPN? Back massage, UAP. Walking the client, what? UAP. Sterile dressing, LPN can do. Finger stick, UAP. Straightforward, right? Next generation NCLEX. Number 16. This is a full case study. Are you ready? If you're tired, take a break, go drink, be ready, get something, and come and do this case study. I'm going to challenge you. You can see that it may be difficult, but this is the way it's supposed to. It's a mental health case. So let's get to it. Client was brought into the emergency room by the daughter. The daughter brought a patient. Client is very tearful, finding difficulties to speak. When you're reading case study, this is the way you read it. Don't just go through them, but every word count. Patient was brought into the daughter. Ask yourself why. The client is tearful, and finding difficulty to speak. Make sure every last sentence connects to that now. I'm going to underline the buzzword. When you read it, you do the same thing. Report feeling down all the time since the spouse died. So somebody died 10 months ago and looking tearful, cannot speak. Appetite has been affected. That means no eating, and feel life is not worth living. Feel hopeless. Client feeling hopeless and sometimes lonely during the holidays, alone because the spouse died. Client has stopped going to church. I'm not going to church anymore. And he's not involved in any more gathering. He doesn't sleep. He sleeps only 3 hours. And he has history of hypertension, migraine, stroke 2 years ago. And he has gained 20 pounds in the last 10 months. What do you think? This patient is in a depressive mode, adjustment disorder. He has passed more than 6 months. Therefore, we get into the point of what? Depression. Now, select 3 information that is concerning based on the data provided, right? 3 information. Which one is more concerning, right? Stop going to church. Life is not worth living. History of stroke. Gain 20 pounds. Sleep for 3 hours a day. Which one is more dangerous? Only 3. Only 3. That's all. When you stop going to church, that's signs of depression, right? Things that you don't like, you ignoring them. Life that is not worth it anymore. That's very, very important. Between weight gain and not sleeping, I'm going to pick not sleeping, because not sleeping is more likely, that's insomnia, more likely to put this patient in the higher risk compared to weight gain. Based on the case, which factors place the client as suicide? So what are the risk factors for suicide? Patient, when they give you this and they give you a bunch of that, count the number of risk factors. Live alone, 1. Non-attending church, 2. Weight gain, only 2 risk factors. Live alone, 1. Non-attending church, 2. Hopelessness, 3. And chronic condition. These are all risk factors for suicide. 4 problem here. Therefore, I'm going to pick you now. Live alone, hopelessness, 2 problem. Tearful, weight gain, live alone, 2 problem. Therefore, B is more serious. Now, based on the data provided, what additional data the nurse should obtain? So what do you want to know? Why do you stop going to church? Is that what you're going to ask the patient? Therapeutic communication? What is preventing you from sleeping more than 3 days and 3 hours a day? Is that a good question? Are you having any thought of harming yourself? Is that a good question? Can you tell me more about how you are feeling now? Which one is the best? Any additional information? Which one is the best one? You pick your answer? I'm worried about you harming yourself because it's a life that's not worth it anymore. That's more important to me. The client confined in the nest that life is not worth living and want to end everything now. You want to stop everything now. Client state, I know what to do. You'll watch. That's threatening, suicide, intent. You say, you watch. I'm going to do something. Suicidal ideation. What is your priority? The client to focus on the living son, notify the air care provider immediately, verify the client statement with the son, call security. Said he's going to kill himself. What do you want to do? Let the doctor know. The nurse informed the ACP. Involuntary admission was ordered. That means we will know that he has suicidal ideation, want to kill himself. We involuntarily admit the patient. That means we admit the patient to the hospital without letting the patient go. What additional orders the nurse should anticipate in the plan of care? If you said this patient, you need to stay, you're not going home, what should you need? Remove personal belongings in the room. Should you do that? Everything from the client room. Put the one-to-one seater on the patient. Do hourly. You should avoid hourly rounds on the client. Provide psychological need. Request prescription for vest restraint. Remove all potential weapon in the client's room. Which one would you do if you know the patient is in what? Involuntary admission and they are suicidal watch. What would you do? What are you going to do? I can tell you all belongings should be removed. They can use it to hang themselves. They need one-to-one. They need what? Hourly round. You should not avoid it. You should provide a physical need, right? Very, very important. You should not restrain them. And you should remove all potential weapon that the client may have with them. Now, the client is ready for discharge. Client was prescribed Precaution. It's an SSRI. This statement from the client is concerning after discharge teaching. After you told them they're going to go home with what? Precaution. Which statement is concerning? I will take the tramadol for knee pain. If you have knee pain, I'll take tramadol. I will join exercise program. I will avoid motoring. I will need to follow up in 2 weeks. Which one is concerning? If you take in Precaution, SSRI, that means you should what? Avoid serotonin containing product. Which one should you worry about? You pick your answer? I can tell you, tramadol is a bad problem. It contains serotonin. If you take it with it, you have serotonin syndrome. Exercise, because you're going to gain weight. Motoring, avoiding, because you affect platelet. And need 2 weeks follow-up, because you have suicide. This is what you need. NCLEX practice question, next generation NCLEX. 5 questions. Question 16. Let me know what you got. How many did you get for this case study? Psych case study can be challenging, but I believe in you. Number 70. And this is working with the LPN or the LVN and an unlicensed UPA. Which task is appropriate to delegate to the UAP? UAP, anything that does not require thinking, that means ADL. That's all. Assessing the client pain level after medication. Providing teaching about insulin administration. Performing a clean catch urine analysis. Reinforcing education on symptoms spirometer use. What do you think? Pick your answer, let me know. But I can tell you, assessment is done by the RN. Teaching, RN. Reinforcement, LPN. Therefore, this clean catch urine analysis will be performed by the UAP. And this is providing teaching to a group of adult clients about recommended health maintenance and screening guidelines. Which of the following recommendations should the nurse include? Don't forget about health promotion. You may see these questions. That's why I put it there. Learn them. These are common ones. Colonoscopy every 10 years after the age of 45. Vaccination. Healthy influenza vaccination in a healthy adult every 2 years. Screen for hypertension only if you have symptoms, and get mammogram every 5 years after 40. What do you think? Which one is a good recommended screening protocol for adults? The right answer is colonoscopy 10 years after 45. Mammogram after 40, you should do it every year, not 5 years. Hypertension, you screen them because it's a silent killer. Influenza, get it yearly. And next is monitoring a client in active labor. Patient is in active labor. The client report abrupt onset of what? Severe abdominal pain, sudden onset of abdominal pain. There's bleeding, that means painful bleeding. Assessment reveal what? Loss of fetal station, another bad way. There's cessation of contraction. Baby has what? Bradycardia. Maternal has what? Hypotension. Something should tell you, mommy is bleeding, baby is not happy, there is cessation of contraction, and this is abrupt, and bleeding is bad. Which condition you should suspect? Placenta previa, placenta abruption, uterine rupture, uterine invasion. Which one? You pick your right answer? I can tell you this is uterine rupture. Previa is painless, therefore this is painful. Abruption, yes, painful, but there is what? No cessation of contraction. Inversion, they will tell you the uterus is what? Involuted, it coming out, you can see the cord out. Therefore, this is not a problem. And this is teaching a parent of a school-age child about with diagnosed with Marfan syndrome. Which information is a priority to include? Marfan syndrome is a connective tissue disease, and therefore there's a big problem you need to let the parents know when you're educating them. This is what is going to kill them. They need to monitor the child for joint hypermobility. They need to monitor the child for scoliosis. They need to monitor the child for lens dislocation. They need to monitor the child to avoid what? Contact sports. You pick your answer. What is your score so far? Question 20. I hope you get above 65. I can tell you this is the right answer because they can have aortic dissection. Contact sports is a bad thing for them. Therefore, we tell them not to do anything. If you're a female, you're supposed to have babies as you get older, have baby before you get older. As you get older, there's more likely to have rupture. Therefore, contact sports should be avoided. Their joint is going to have hypermobility, expected. They're going to have scoliosis, expected. They're going to have lens dislocation, expected. But contact sports will cause what? Aortic dissection. You should avoid it. And this is reviewing prescription for lipid-lowering medication for several clients. Which of the following medication combinations should the nurse suspect? This question, if you don't know, stop the video, write what I'm going to say. This is being asked multiple times. This is a recommendation from students who pass the NCLEX, and this is what they find. This is very important. Everybody worry about what? Statins, but they can throw these at you, they want to test you. Which combination is bad? That's all, and write it. Atorvastatin and ezetimibe. Simvastatin and gemfibrozil. Rosuvastatin and omega-3 fatty acid. Pravastatin and cholestyramine. Simvastatin and what? Niacin. Which combination? This word, I want you to write it down after you pick your answer choice. You can make any combination with statin because that's what everybody knows. So they're going to give you statin. You can combine statin with any medication they give you that is lipid-lowering medication. If you say lower cholesterol, yeah, except this gemfibrozil and niacin, high dose. Why? This statin causes what? Rhabdomyolysis, muscle pain, muscle cramp. If you combine it with gemfibrozil, high dose of niacin, you're more likely to get rhabdo and you get into complication. Therefore, this and that are your right answer. But all other options are fair game. So you don't have to memorize. Just remember too that you can't combine with the G, gemfibrozil, and the N, nice. And next is assessing a 5-month-old infant during a well-child visit and note persistent strabismus. What is strabismus in a 5-month-old? What should you do with it? What action should you take? What is the priority next action? Should you freak out? Should you go and see ophthalmology? Reassure the parent that this is normal and will self-correct. Refer the infant to pediatric ophthalmologist for evaluation. Instruct the parent to perform patchy therapy at home. Teach the parent high exercise to strengthen the weaker eyes. What do you think? Very, very important information. Strabismus in a 5-month-old. Write it down. Concept. Strabismus is normal in a newborn. It can persist up to 6 months. After 6 months, you see a doctor. Therefore, reassure. Refer is after 6 months. Ensure that patchy therapy after 6 months. Teach them to put straight in the other eye after 6 months. But this is acceptable. 5 months is acceptable. You don't need to do anything. You can persist for that. Therefore, that is eye misalignment and it's common in kids. Therefore, that is a problem. And this is caring for a client who had a chest tube injected 6 hours ago for the treatment of pneumothorax. Chest tube, how do you manage it? Which of the following findings should the nurse identify as requiring immediate intervention? When you study in chest tube, don't just watch everything, read everything. Draw yourself a chest tube and say, what happened at each chamber? This is all about chest tube. If you want to know chest tube, know what happened at each chamber. Continuous bubbling in the water cell chamber. Is it true? Sudden increase in output. Should I worry about it? Absence of tidally in the water cell chamber. Is that concerning? Intermittent bubbling in the water cell chamber with the client coughing. Oh, something wrong? Subcutaneous emphysema around the chest tube. Are all these a problem? Maybe. What do you think? He said, require immediate intervention. The water cell should not have continuous bubbling. I'm worried about it. Sudden increase, maybe bleeding. Absence of tidally, there may be through blockage or something like that. It should be tidally. Show me the patency of the tube. Intermittent bubbling in the water cell, expected finding. Subcutaneous emphysema around the chest tube. Should I worry about it? No, because it was placed for pneumothorax. That's an expected finding. It will get better slowly and it will go away because it just placed a chest tube. If it was placed more than over 24, 48 hours, yeah, I should worry about it. But this is expected finding. And this is caring for a client who has experienced evisceration following abdominal surgery. That means the fascia, the connective tissue opening, the wound opening, and bowel coming out. What do you do in this situation? Which of the following steps should the nurse take to address the complication? Arrange the steps in the correct order. How do you prevent this? Or when you see it, what do? Notify the healthcare provider immediately. Provide sterile saline so gauze over the bowel. Client in the lower phalanx with knee burn. Then what? Assess the client vitals. Provide emotional support and reassurance. If you see this, you're taking care of a patient who has bowel coming out. What's the first thing you should do? Arrange them. The first thing is to prevent further what? Evisceration. So put the patient all the way down, phalanx position, and then cover the bowel. Don't push them in with the sterile saline gauze over them. And then let the doctor know we have a situation. Then you do what? You check the vitals first because you got to take care of the patient, and then you let the doctor know and you provide emotional support. So pay attention. Everything is about the patient. Until you get the patient in order, don't call the doctor. Somebody can call the doctor. Client in the lower position, cover them with the sterile saline soap gauze, and then check their vitals, notify the healthcare provider, and then support them as we wait for surgery. And let's provide care for a client experiencing acute mania, bipolar patient, which actually the nurse should prioritize. Hey, we got to prevent that. We can stop it, but we can do something for you. Group therapy, provide high-calorie finger food, anticipate prescription bupropion, place patient in seclusion. Bipolar, what is the management? In maniac state, calm them down. And then provide some physical need. What is that? Group therapy, wrong answer. You're supposed to do what? Initial therapy is with you. Calorie diet, finger food, so that they can keep moving because they're not going to stay. Bupropion will make them have more energy. Don't give it to them. Don't give bupropion to bipolar patient. Seclusion is going to worsen the situation. Keep them with you. And let's provide care for a client in end stage of dying. Patient is dying. Which intervention the nurse should teach the family to provide comfort to the client in this final hour? This is what? End of life care. Best care, comfort. What do you think? I went through all the division, all the subdivision of the NCLEX, all the things they ask you. I took the question breakdown from physiological adaptation, and I put the same number of question in all this. How much pharmacology you're going to see, how much maternity. That's why you're seeing this kind of question. What do you think? Gentle hand massage, talk to the client, allow the client to refuse feeding, insert feeding tube for adequate nutrition, and daily dressing, daily bedside reading. How can you provide end-of-life care? Somebody who's going to go. What do you think? It's okay to touch them, talk to them, let them refuse, because when they get to this stage, they have anorexia. They don't want to eat. You don't want to feed dying body. So the patient will refuse to eat. Therefore, don't insert feeding tube to feed them. And just read for them. It's okay. Did you get all of them right? I know you got it, because I've done a bunch of end-of-life care and things that it's all the same thing, repeating itself. No matter how they frame the question, if you know the concept, use it to answer the question. 27. A nurse is caring for a client at risk of fall. Which of the following should the nurse check at the hourly round? Select or apply. It's the same thing. You see, every 4 questions fall under that. If the patient is going to fall, do you check their bowel movement party? Check the position of the bed? You check the patient pain level? You check how their belong to closer to them so that they don't get out of bed? And you check if they have assistive device around them so that they can use them when they're trying to get out of bed. What do you think? Of course. When was the last bowel movement so that you can get them to bed? Is the bed in the right position? Do they have pain? They can be anxious. Can they reach for their Bible, their whatever they have in their belongings? And do they have assistive device they can use to get out of bed? All this acceptable at your hourly rounds to prevent fall. What do you think? This question is challenging, but it's not. It's just based on concept. And I know you know it. And then I know you're going to do me proud. So, what is the question asking you? That's all. What is the question asking you? And this is assessing a non-verbal adult client about pain. That's all. Patient is non-verbal about pain. Which pain scale is the most appropriate for non-verbal? That means if you're not talking, how would I know you have pain? And even if you don't know, I will show you. Numerical rating scale. That means there's a number. 1 Baker faces. They give you faces and then you point it. Flag scale and a visual analogy scale. If you're not talking, which one is good? I can tell you it's the flag. It's good for non-verbal because it's what? We look at your face, leg movement, your activity, your crying, whether you can be consolable. And this is used for kids that cannot talk. This is classic for them. That's what you use. All of this requires verbal. You got to say something. When you look at a face, you got to point, and you got to say, yeah, I have pain here and that. So pay attention. Best care and comfort question. This is physiological adaptation question. Don't over-select. I'm just giving you warning. Don't pick too much. Focus on the buzzword. The condition may look harder or bad, but that doesn't mean you should pick it because it may not answer the question. Which of the following finding indicating rising ICP? That means your ICP is going up. When patient ICP is going up, what do you see? That's all. And this is caring for a client with a traumatic brain injury. Is being monitored for an increased ICP. What is increased ICP? Narrow pulse pressure, tachycardia, projectile vomiting, regular respiration, hypotension, and uptraining Glasgow coma score. Which one is correct? Which one indicated? Stop the video and then pick your answer and let me know. You pick your answer, question 29. When your ICP is going up, you have something we call Cushing triad. And this Cushing, you have what? Wide pulse pressure, not narrow. Wrong answer. You have bradycardia, not tachycardia. You have projectile vomiting. Excellent. Your respiration is going to be irregular, not regular. You have hypertension, not hypo. Your blood pressure goes up. And your GCS will go down, not trending. If you select, you get 0. But the right answer is only projectile vomiting. I change all the key facts that you know that may trap you. But increasing ICP is nausea, vomiting, hypertension, bradycardia, irregular respiration, downtraining GCS, and wide pulse pressure. And let's provide care for a client diagnosed with what? Depression. The next should anticipate a laboratory testing for what? If you have depression and I want to rule out anything, the certain condition that look like depression, some signs and symptoms look similar to depression. Which lab test are we going to get? Complete blood count, complete metabolic panel, thyroid function test, lipid profile. What do you think? The thyroid function test is what you get to rule out hypothyroidism because it presents like depression, mood disorder. Very, very important. Mental health. And then it's evaluating psych mental health. Evaluating a newly graduated nurse, understanding following a staff education session on defense mechanism. Which of the following defense mechanisms should the nurse match with the correct description? How would I know this is rationalization, denial, sublimation, displacement? These are your reasons. Pair them together. Which one is unacceptable to acceptable condition? You move from unacceptable to acceptable condition. You're transferring your feeling towards one person. Then you are not accepting the fact. You're making excuses. Which condition is that? Which condition? You pick your answer, you pair them. Rationalization, you're making excuses. You deny, you're not accepting anything, no matter what. Sublimation, bad stuff, you turn into a good thing. Unacceptable to acceptable condition. And displacement is taking your bad stuff onto somebody else. This is the definition, simple definition. If they expand it, still use this to analyze the answer choice. Defense mechanism for you right here. And then it's scary for a client who is at risk of developing hypovolemic shock. Which of the following findings indicate that a client is experiencing hypovolemic shock? That's physiological adaptation. Select all that apply. Tachycardia, warm floor skin, urine output 750 for the past 2 hours, mean arterial pressure of 60, restlessness, pounding peripheral pulse. Think about it. Fluid and electrolyte, put it together. Hypovolemic shock. My blood pressure is low. What is going to happen to me? And pick your answer choice. I know you're going to get all of them right, but don't over-select. Pick those that you are 100% confident. Which one? Which answer choice? If you are in shock, what is going to happen to you? You're going to be tachycardia. Your skin is not going to be warm flush. It's going to be cold and clammy. Wrong answer. Urine output of 75 ml for the past 2 hours. That means you're making more than 35 ml per hour. That's good. If your MAP is 60, you're good. Your blood pressure is fine. If you're restless, that is hypoxia, consistent with what? Shock. If your pulse is bounding, you're normal. Your blood pressure is normal. These are signs of shock. Pay attention to them. And this is assessing a cranial nerve, what? 12. Function in the client in the emergency department. Which instruction should the nurse give to the client? Cranial nerve 12. Do you know the function of it? How do you test it? This is how you learn cranial nerve. Know the cranial nerve there, find the name, and then ask yourself, what kind of test will you use to do and test the function of it? This is what way NCLEX will ask you. You have to know the function of the cranial nerve and how to test it. Follow my finger with your eyes. Am I testing 12? Smile and show your teeth. Am I testing 12? Stick out your tongue. Am I testing 12? Stretch your shoulders against resistance. Am I testing 12? You pick your answer? I know you're picking the right answer. But if you follow my finger, extraocular eye movement, I'm not testing 12. If you smile, you show me your teeth, that's facial, right? But when you stick out your tongue, 12. Stretching your shoulder, 11. Accessory nerve. Therefore, these are the right answer. Psych, mental health concept. And then is collecting data from a client with schizophrenia who is what? Repeating words uttered by the nurse during the assessment. When you say up, they say up. When you say book, they will say book, repeating your own words. What thought impairment is that? Echolalia, clang association, word salad, tangential. So which of this, if I repeat your word, whatever you say, come, and I say come, what is that? You pick your answer? I know you got it. It's echolalia, repeating the examiner's word. Clang association, you're rhyming, right? Word salad, basically jumbo, and tangential, moving from one topic to another. Therefore, echolalia, thought impairment. And let's provide care for several clients. Which client situation require immediate intervention? You have a patient with the COPD complain of heart palpitation after a beta agonist. You have a patient with schizophrenia complain of auditory hallucination. You have a patient with Menera disease complain of room spinning. And you have patient with pericarditis complain of chest pain relieved by leaning forward. Who do you want to see? Which situation should you worry about? Pericarditis, complain of chest pain, expected finding. Menera disease, complain of room spinning, that's what I expect. Schizophrenia with auditory hallucination, I need to investigate it. And you have COPD, having heart palpitation, I've given you beta agonist, that's albuterol, expected finding. Don't worry about it. And as I says, the client after what? Starting escitalopram 7 days ago. Which statement made by the client is concerning? I have gained 2 pounds in 1 week. I donated my new car to charity. My sex drive is low. I feel the same as before. You started with escitalopram, that's SSRI, 7 days ago. And they're telling you that they've gained 2 pounds. They donated their car to somebody. Their sex drive is going down. And I feel like the same no matter what. Nothing has improved. Stop the video, pick your answer, put it down, keep track of your record, and see how you're doing, because I know you're going to get more than 65. You pick your answer? Whenever you start SSRI, antidepressant, watch for suicide. Which statement indicates suicide? Donation, giving out your belongings is a bad. Sex drive, going down, expected. Libido, you're going to gain weight, expected. You may not feel the improvement because it takes 3 to 4 weeks for you to get better. That's the right answer. And next is caring for a client who's been prescribed Aripraprizole pharmacology. This is psych medication. This is what? Antipsychotic. Which of the following statements by the client indicate correct understanding? Aripraprizole. I want you to know this psych medication, antipsychotic, because it's one of the antipsychotic that is new. Abilify. If you watch TV, that's what you hear. It has a very specific side effect. I should expect to gain significant amount of weight while taking the medication. This medication may cause me to feel restless, unable to stay still. I will stop taking this medication once I feel better. This medication works immediately to relieve my symptoms. Which of these indicate correct understanding? It's a psych medication, antipsychotic. You pick your answer. Which one you pick? I know you picked the right answer. I know you do not pick weight gain because it does not cause weight gain. One of the major new medication, antipsychotic, that does not cause weight gain. And you know you're not going to stop the medication when you feel better. And it's not going to relieve your symptoms right away. The major side effect is akathisia. And that is what? The medication may let me feel restless and able to stay still. Akathisia is the most common side effect of what? Aripraprizole. Therefore, no doubt. And next, provide care for several clients. Which client prescription? The next question. Client with asthma prescribe what? Metoprolol for hypertension. Client with TB who is prescribed what? Isoniazid is also been prescribed atorvastatin for high cholesterol. A client with clostridial difficile infection who is on chronic omeprazole therapy prescribed what? Metronidazole. A client with irritable bowel syndrome prescribed what? Dicyclomine and artificial tears. When you see this kind of question, they're very intimidating. I will guide you to see next time when you see that's how you approach it. They say you should question. Therefore, the condition is asthma. Can I take metoprolol for my hypertension? The condition is TB. I'm on isoniazid, but I also been prescribed atorvastatin. Can I take both? I have C. diff because I take omeprazole. And can I take metronidazole for it? I have irritable bowel syndrome. I've been prescribed what? Dicyclomine and also artificial tears. What do you think? Which one you should question? You pick your answer. This is pharmacology, combination, testing your knowledge. Dicyclomine is anticholinergic. If you have irritable bowel syndrome, we'll give you this dicyclomine. But because of anticholinergic, you have dry eyes, so we give you artificial tears. If you take omeprazole chronic, you're going to get C. diff, and we give you metronidazole to treat it. Isoniazid can be used for PPD positive, but atorvastatin also can affect your liver. Isoniazid affect your liver, atorvastatin affect your liver. You can combine them together. Asthma patient can take metoprolol. It's a selective beta blocker for their blood pressure. Therefore, that's acceptable. Which one we should question? Isoniazid in that one. It requires a lot of combination. You can take a picture of it next time when you see this is how you approach them. Another case study. Are you ready? If you're tired, go get something to drink, go get something to eat, stop the video, come back. You don't have to do all the 85 at once, but I want you to train yourself to sit down and simulate and do all of it at once so that you can master it. 10-year-old child with acute onset of voiding of what? Tea-colored urine, 10-year-old pink tea-colored urine and reduced urine output, renal failure, right? The child was treated with what? This is the bars read 1 week ago for strep pyoderma. That was confirmed by Precaution. So he had strep infection. His face is big now, puffiness around the eye, and mild swelling on both feet. Temperature 101, heart rate 105, and that. Is a letter-oriented, long, clear, bilaterally periorbital swelling. There's moderate PD edema, no ascites, and the kidney, no kidney mass. Therefore, all his kidney function is because he has strep and all of a sudden his peeing T-colored and urine output is going down. His bilirubin and creatinine is elevated. What do you think is going on? Connect it together. I'm leading you strep infection a week ago. All of a sudden, I have T-colored urine, reduced kidney function, hypertension, puffy, face, and then my lab work is abnormal. The next, review the clinical data. What condition the client is suffering from? What do you think? What condition is the client suffering from? Is this a rheumatic fever, acute liver failure, nephrotic syndrome, or post-strep glomerulonephritis? It's not rheumatic fever. You already have infection. If it's rheumatic fever, I'll tell you something about the lung, the heart. There's no evidence of liver failure. This is not nephrotic syndrome. The patient has strep infection before, and this happened. This is post-strep glomerulonephritis. Therefore, which of the following clinical data is a priority? What do you think? Which of this is a priority? T-colored urine, moderate PD edema, hypertension, and tachycardia. Post-glomerulonephritis is very, very important. Post-strep glomerulonephritis, the most important thing you should worry about when you see it, because the kid is now as renal failure, retaining fluid, is going to get into trouble. That's what is increasing the pressure. The number one thing you should worry about is what? T-colored urine. Should you worry about it? Moderate PD edema. Should you worry about it? The blood pressure or tachycardia. Which of these should you worry? Should concern you? Don't forget, when you see that post-strep glomerulonephritis, hypertension, because that's a major condition. The client is at risk for what? Permanent kidney damage, pulmonary edema, cerebral edema, hypertensive encephalopathy, severe fluid retention. What do you think? I've given you the clue, and you can see because their kidney is in trouble, they're retaining fluid, they may have kidney damage. This relates to pulmonary edema. And the hypertension, they get cerebral edema. And they develop hepatic encephalopathy, hypertensive encephalopathy, and they have severe fluid retention. This is why hypertension is a priority for this patient. The next is review clinical data. Which lab work is suspected? Remember, it is post, not acute strep infection anymore. Therefore, which one do you think we should worry about? The kidney function is going up, so we need to check it. And we want to see if the titer is elevated, whether they be exposed to strep infection. And this is what we check. Antistreptolytes in titer, and see if they were previously infected. The complement, this is what causes the kidney to destroy. There's not going to be an increase, it will decrease. And they're going to have red cast and proteinuria. This may be a hard case study for some people, but know the concept. Next time you see it, as we learn, you master it. And then review the clinical data to develop plan of care for the client. Which prescription the nurse should expect in the plan of care? The concept is the same. We have kidney problem because we have infection due to strep, and now the kidney is in renal failure and peeing T-colored urine. I may have hypertension because my kidneys don't function. What do you want to do? Which should the nurse expect in the plan of care? What do you think? We're not going to give the kid ketorolac. That will affect the kidney. Of course, we got to let them be mobile. They can't stay in bed forever. And because they are fluid overloaded, we're going to give them infusion of diuretic. They have too much fluid, they're not going to get isotonic infusion. We need to weigh them, and they should restrict salt. It's like the same thing, somebody is fluid overloaded, the same management. The client is ready for discharge. Which of the following teaching is appropriate? You have to know how to care for this patient between post-strep glomerulonephritis and then nephrotic syndrome. This is post-strep. How do you care for this? The child will need some blood pressure medication. Hypertensive medication is temporary, short term. The child should avoid high salt diet. The child may expect some blood in their urine still. The child will continue to have tea-colored urine, and the child may stay away from friends with infection. What do you think? Pick your answer. Let me know. The last question on the case study. They're more likely to get infection, therefore stay away. They're not going to have tea-colored urine. They may improve, but they may expect some blood in their urine. They should avoid high salt because what? They are fluid overloaded. And then hypertensive medication is temporary and they may need it. Therefore, this is how you manage this patient. Pay attention to that. Watch this portion for the video multiple times. That's why I keep on going back and forth. So that next time you see it, you know post-strep glomerulonephritis is a non-acute condition. It's like a rheumatic fever, but it's a different condition. Number 40. How are you doing so far? More than halfway. You're doing great. A nurse is caring for a client undergoing chemotherapy who has a temperature of 101.5. I don't like it. Chemo and temperature, I don't like it. What will you do then? What is the next priority? Notify the provider, give the patient antibiotic, place a peripheral IV, obtain a full set of vitals. What is your priority? Management of care, prioritization. What do you pick? Of course, you got to have a full set of lab to talk to the doctor. You don't know patients in shock. Just because they have temperature 101.5 doesn't mean the blood pressure is low, heart rate, and all those things. You got to get them before you can let the doctor know. And before you can prescribe antibiotic, before you give the antibiotic, you got to draw crutches and you need an IV. So that's what you need to do. A client with Alzheimer's is trying to leave. Remember, Alzheimer's people, difficult. What is the next best response? You can't leave right now. Let me walk with you and we'll talk. You need to stay here until the doctor says, okay, call security immediately. Alzheimer's, what is your strategy? How do you care for them? You know they have memory issue. Which one would you pick? Number 1, redirection. Which one is redirection? Walk with them and talk. Probably you guys pass somewhere and turn around and back to the same thing. But if you say you can't go, well, that's a problem. If you say stay here, they're not going to stay. Just walk with the patient, take another route, and come back. The nurse is aware of all clients. Which client should the nurse see first? Kidney biopsy, and I'm making 100 ml for the past 3 hours. Is that okay? Am I bleeding or whatever? I have severe left calf pain when I'm walking. Then when I stop, it goes away. I have AV fistula and it sounds really loud on auscultation. I had a cerebral angiogram. My heart rate is 110, 1 hour after the procedure. Which one is concerning and which one you should worry about? Prioritization. You got to be sharp. Which one is suspected? Which one is not suspected? Kidney biopsy, 100 ml, 3 hours, more than 35 cc per hour. You okay? Left calf pain. When you walk, relieved by rest claudication, you're not dying. AV fistula, I'm supposed to hear a brewery, expected. Therefore, by default, angiogram, when you have tachycardia post, you bleeding. This is a bleeding problem. A client with moderate Alzheimer's disease told the nurse that this place feels like jailed for me. Therapeutic communication, psych medication. Can you get me out of here because this feels like jail? What is the next best response? Everybody feels that way. You will get over it soon. Why do you feel the need to leave this place? Tell me more about what makes you feel you are in jail. Prison is worse than this place. You should be grateful. What do you think? What do you think? She said this place feel like what? Jail. She want to leave. Alzheimer's. Therapeutic communication. What is the strategy? Pick your answer. And I know you pick your answer by using this word. Ask for more. Which one is asking for more? First one. Patient is not everybody. Answer their question. Why answer choice you should not use. Prison is worse. You never answer the question. A nurse is preparing to give a medication to a client. The question, which question should the nurse ask before giving the medication? You've given medication multiple times. When you go to the patient room to give them medication, what do you ask? You ask them about the time. You ask them about the room. You ask them to say their full name, their date of birth, what is today's date, and what are their allergies. You know this is put in the question form. Should that disturb you? No, it's just the same thing. Two identifiers. Which one are identifier? The time is not your identifier. Your room is not your identifier. Your name is your identifier. Your date of birth is your identifier. Today's date is not your identifier. Neither is your allergies. Don't pick it. And this is aware of 4 clients who need to be seen first. Prioritization, management of care. Client with a 9 out of 10 right upper quadrant pain on a scale of 10 radiating to the shoulder. Yes, right upper quadrant pain. Client with tea-colored urine after strep infection. We saw it, right? Client with temperature 101.5 and he's confused. Client with the blood pressure 170/70 and reporting thunderclap headache. Who is in trouble? Who need to be seen first? Who condition is worsening that you want to progress and do something better? Expected finding, ignore it. Tea-colored urine, because you have strep, expected finding. Right upper quadrant pain, going to your shoulder, cholecystitis, expected finding. If you have thunderclap headache, SBAR, I'm worried about it. I know this patient has sepsis, they're confused, but SBAR hemorrhage, you're going to die. And this is providing teaching to a client who was scheduled for bone marrow biopsy procedure. This is one of the new English test plan language. These are procedures. They focus on now some procedures you have to know. Which of the following statement by the client in the correct understanding? Bone marrow, what? Biopsy. I'm taking bone marrow. For what? The test will be performed while I'm laying flat. They said taking it from the iliac crest. So think about it. Bone marrow. Am I going to lay on my back? I will need to stay in bed for about an hour after the test. I will be under general anesthesia during the procedure. The test will determine which anticoagulation I should be taking for treatment. Which one indicate correct understanding? If you're doing bone marrow biopsy, what is it for? How do I get to the bone? And what would I do after the procedure? What should I let you know? That's what the question is asking. It's asking all the things that they want you to know about bone biopsy. The test is done when you lay flat. One is wrong. You have to stay in bed for an hour at least to prevent bleeding. It's done under local anesthesia. And we're not doing it because of anticoagulation. You may have cancer. And this is caring for 5 clients. Who is ready for discharge? Select and apply. Amyotrophic lateral sclerosis with what? Dysarthria. AFib with the INR of what? 2. Asthma with the peak flow of 81. Chronic obstructive pulmonary disease with saturation of 90. And myocardial infarction with the new S3. Who can go home right now? That means who is fine to go home. If you go home, that means you should be stable. ALS with dysarthria, you are not stable. AFib, INR of 2, you're ready to go. Asthma peak flow of 81, you're ready to go. And a COPD with saturation 90, you can go home. Myocardial infarction S3, you're not ready to go. And this is evaluating a newly hired nurse following staff education session on IV therapy. Which of the following solutions should the nurse identify as appropriate to mix with an antibiotic prior to IV administration? Another 2026 language test asking about mixing of medication. Which of this can you do? If you have to mix the medication, antibiotic, what medication solution do you use? Sterile water, 29% normal saline, 5% dextrose, lactate ringer. Know it. I know you know it. You've been in the hospital multiple times. When they give you a pharmacy, you got to reconstitute it. What kind of common IV solution do you use? What do you think? The most common is normal saline 0.9. You can use dextrose, but dextrose is not universal. 0.9 is most universal. And this is caring for a client receiving warfarin for anticoagulation. This is just basically testing your knowledge that you don't get trapped. You don't pick things because you see it's abnormal. Which of the following laboratory results indicate the need to increase the medication dose? Patient is getting warfarin for anticoagulation. Which one? When I see I need to go up on the dose. The strategy is, what do you monitor when you're taking warfarin? That's all. Don't get trapped with anything. Prothrombin time, 24 seconds. INR 1.3. PTT, 40. Creatinine, 1.2. You pick your answer? What is your answer? You pick it? I know you pick it. And you pick the right one, because I know you don't pick prothrombin time, right? Even though it's abnormal, we can use it for when you're taking warfarin. We don't measure that. That's not our priority. We prioritize our INR. And PTT is for what? Heparin. Creatinine, abnormal. It has nothing to do with it. So just be careful. Don't over-select. Don't overthink the question. Therapeutic humidine is based on INR rather than PT score. And this is caring for unconscious clients who is vomiting. He's vomiting. You got to protect the airway. Which position would the nurse place the client? Which is the best position for patients vomiting to protect the airway? Supine, eye fara, side laying position, trandelibed. That means their head is down. This is their side. This is the completely upright. You pick your answer? Positioning. This is client safety, client positioning. If you need help, check out Dr. because I have a bunch of positioning questions that you can practice. But high fara is too high. Patient is vomiting. Let it lay on your side. It's much better. Protect the airway. When they're upright, they can vomit and go back of their throat and they aspirate it. And next is developing plan of care for a client who is at risk for fall. Which of the following is appropriate worded goal for the client? Same thing. 2026 type of question. This is what it is. You know it. They will just use different words to try to trap you. I want you to step back and say, what is the question asking me? And then she's developing a plan of care for a client who is at risk for patient is going to fall. Which of the following is an appropriate worded goal for the client? That means you want to prevent fall, but how would you word it? That's all. The client will use the call light before walking within 24 hours. The client will not fall during hospitalization. The client will understand fall precaution. The nurse will ensure the client remains safe. Which one indicate the goal, worded goal? Use the nursing process. Which one tells you that you have a complete goal? You pick your answer. I want anybody who get to number 51. Thank you very much. And thank you for watching. Thank you for supporting the channel. Thank you for sticking around. And if this video is helping you, just put the like button and say, I've reached 51. And I want to know your answer choice for 51. The strategy is to use this. Every time you see goal, think about SMART. SMART goal. That's what we call it. And that is what? It has to be specific. Which one is specific? It has to be measurable. I have to be able to measure it. And it should be timed. Therefore, if it's not specific, it's not measurable, and it's not timed, then I cannot use it. The nurse will ensure the client remains safe. How can you measure that? The client will understand fall precaution. Can you measure it? It's not specific. There's no time. The client will not fall during hospitalization. Okay, but I cannot measure it. But if I see 24 hours, it will use the call light specific. There's a goal. It will work. Number 1 is the best answer choice. That's how you answer these new questions. Don't worry. Just sit back and then analyze the question. You can see that is a language. Some of us are not from here, but English is not our first language, but we learn it. But don't let that intimidate you. Don't let that affect your score. Just sit back, analyze the question, and master it. A nurse is preparing to administer medication to a client. I want to give a patient medication. Which of the following medication should the nurse use? Pay attention. Z-track technique at what? 90 degrees. That means if I'm going to give you this medication, I have to use Z-track technique at 90 degrees. Heparin injection, iron, insulin, allergy. Which one you need to use Z-track? First, you got to know which injection site do you have to use Z-track and in 90 degrees. You pick your answer choice. I know you pick it, and I know you get the right one. Which one was it? Iron. Iron is given by IM, 90 degrees. Heparin is sub-Q, right? Insulin is also sub-Q. Allergy testing intradermal, 15 degrees. Therefore, this is the right answer. This is a hard one. It's my favorite question. Go back to it and pay attention. And next is caring for a client through severe enteral feeding via nasogastric tube. Which action is the next priority? You can see a bunch of safety question, medication administration, because that's what the NCLEX will ask you. Safety is about 15%, 11 to 15%, and pharmacology 18. And this is how the question distribution. So you got to know them. And this is caring for a client through CV enteral feeding via NG tube. Which one should you prioritize? I'll give you a clue. Aspiration. Elevate the head of the bed 30 to 45 degrees. Check residue volume every 4 hours. Flush the tube with water before medication. Monitor intake and output. Which of this will prevent aspiration? What do you think? Elevate the head of the bed. Checking residue does not prevent aspiration. It's usually basically you're checking how much in the stomach. But if you keep the head out of bed, it's better. Flushing the tube does not prevent aspiration, and you should not prioritize that over anything. And next is teaching a client about home safety. Which statement by the client indicate correct understanding of the teaching? Safety question. I'll store my medication in the bathroom cabinet. I will keep medication in the original container. I will share my medication if someone has similar symptoms. I will store some of my medication in my car storage compartment. There's a concept, there's a theme that keep on repeating in that answer choice. What do you think I'm trying to emphasize to you? You pick your answer. That medication stay in their container. There's some that does not like sunlight. You put in the glove compartment of your car, you are in trouble. You should not give your medication to anybody. Just keep it in the container. Bathroom cabinet may not be the best place. It's too humid over there. And let's administer metoprolol IV to a client. The physician prescription read, give metoprolol what? PO. PO medication, you give IV. Medication administration error. What do you do first? Safety, pharmacology. Document the medication administration as given. That means you document first. You complete incident report first. You check the patient vitals first. You notify the provider first. Which of these will you do after you cause harm to the patient? Assess the patient. See if the patient is doing okay. Give them instruction not to get out of bed. Call the doctor. Document whatever happened and provide your incident report. This is very, very important. Very, very important. Assess the patient, monitor them, notify the doctor, document everything, then document your incident report. And then it's teaching the client how to manage ambulate with using crutches with prescription of no weight bearing of the left leg. Assisted device can be very difficult, but you have to pay attention to the bars where it said what? No weight bearing of the left leg. That's the question. No weight lifting, weight bearing of the left leg. And therefore, which instruction should the next include? That means which one would you include? If I have two legs, I'm using crutches, and this one is affected, what would I do? Should I support my body on the axilla while using crutches to prevent fall? Should I place my weight on the left leg when stepping forward? The top of the crutches should rest directly under my axilla when standing. Should I lower the crutches and the left leg, then follow it with the right leg when going downstairs? That's using crutches. How do you ambulate with it? You pick your answer choice. Which one is correct? Which you think is reasonable? You should not support your weight on your axilla. You cause injury. You should support it with your hand. Place your weight on the left leg when stepping forward. When stepping forward, they said non-weight bearing. Why do you want to do that? Non-weight bearing means you shouldn't put weight at all. You should put weight on the right. Your top of the crutches, there should be at least 2 finger breadth between that and the padding. When you're going down, you go down with the going down, you go down with what? The bad leg. Therefore, lower the crutches and the left leg. Then you follow it with what? The right leg. Go down with the bad leg, up with the good leg. Therefore, this is your right answer. And next, prepare to administer iron medication to adolescent client. Which action by the nurse is appropriate? So adolescent, you have to know this is pediatric, right? Very important. Growth and development. There's certain stages. Hospitalization has effect in this patient. I'm trying to prep you how you can use to answer the question. Don't overrate it. Adolescent, yeah, this is peds, age appropriate. Whenever you see that word, that means put yourself in. What do you think they expect from you? Adolescent, what do they care? Describe the procedure as you relate to imaginary figure. Do you think adolescents care about this? Do you think they care about it? Ask the client parent to assist with the procedure. It's an adolescent. Do you think it's necessary? Explain the procedure to the client. Is that okay? Promise to reward the client with ice cream if he or she cooperates with the procedure. What is the main idea of adolescent? They care about what? Body image. They don't care about imaginary figure. They don't need to assist you with the procedure. They're reasonable. You got to talk to them. Body image. Explain to them why you're touching them. Rewarding is like a toddler. They don't need to reward them. This is fine. Same strategy. And let's prepare to initiate IV access for a preschooler. You know what these people like. Who need isotonic fluid resuscitation. Which action by the nurse is developmentally appropriate in this situation? Same thing. You see this language, don't run away. You know it. It means preschooler, young one. I want to insert IV. How can I do it successfully? Think about their cognitive thinking and what stages are they? Do they care about their body image? Do they worry about strangers? Do they think this is a punishment? Do they think losing control? And then try to counteract that. That's all. Preschooler, allow the child to play with the equipment. Tell the child the reason why you're placing it. Do you think they care about the necessity? Discuss to the child how this will affect their body image. Do you think they care about their body image? Insert the IV without letting them know. Bad idea. This is not good. This is like an infant. They don't care. Discuss the child how this affect them. That's an adolescent problem. Tell the child the reason why IV require access is in detail. The same thing, adolescent. These people, let them play with it. They're magical. Basically, you can use it in magical thing. They love the equipment. You can distract them. And this is providing district teaching to a client prescribe what? Isotretinoin, Accutane, right? For acne. Which of the following instructions should the nurse include? I want you to know this medication code and all the information I've given you It's all you need. You don't need to worry about after this question. When you see isotretinoin, you will see all these answers. Trust me. If not, text me and put a comment in this video and say, I saw isotretinoin. I did not see any questions associated with this. This is the answers they will give you because it's common, high yield, and please loved it. Selected apply. And he has a lot of information to test you from. Use one form of contraception during therapy. You are allowed to donate blood while taking this medication. Take vitamin A supplement daily to prevent toxicity. Call your healthcare provider immediately with dry skin and lips. Avoid becoming pregnant while taking this medication. Notify your healthcare provider with any symptoms of mood changes. What do you think? Which one you should include when you're teaching somebody prescribe isotretinoin? You pick your answer, I'm going to tell you, I'm going to show you strategy. I change the answers the way I know you may be trapped. Don't pick number one. You see form of contraception, they need two. One form of contraception is not enough. Therefore, don't include it. You cannot, what? Why? Because this medication is teratogenic, very bad problem. You are not allowed to give blood because it's a teratogenic. Therefore, no. It's the same as vitamin A. It's derived from vitamin A. Isotretinoin is derived from vitamin A. Therefore, if you take too much vitamin A, you become toxic. So take vitamin A daily to prevent toxicity is actually wrong. If you take vitamin A, you have toxicity. Call your healthcare provider immediately with dry skin and lips. It's suspected finding. You don't have to call me. Avoid becoming pregnant while taking this medication. Yes, because it's teratogenic. And notify your healthcare provider with any signs and symptoms. It causes mood changes. That's why we got to watch you. Suicide. This is the problem. But all these is things that you have to teach the individual and you have to pay attention to. So the key is no baby. You can't get pregnant. Everything is going to get dry, especially your lips, and there will be mood change. But pay attention. But know the two forms of contraception. And next is providing teaching to a parent of a different age group about the negative effect of hospitalization. Match the effect of each age-appropriate group to indicate correct understanding. I put everything together. You see the previous question? This is going to help you consolidate so that when you see a question about negative effect of hospitalization in infant, toddler, preschool, school age, adolescent, remember this slide and take a picture of it. What is going to happen to the infant? Effect of body image, loss of control, regression, stranger anxiety, and punishment. How do they consider hospitalization? You pick your answer, put all of them together, 5 points. I can tell you, they usually stranger anxiety. They don't want to get involved. And the toddler, you got to ensure routine. Therefore, they regress. If you don't ensure routine, let them do things they do at home all the time, they will regress. Preschooler, they think you're punishing them. And the school age, they feel like they're losing control. And adolescent, effect on the body image. So every time you want to do a procedure, think about these 5 things. Think about the effect and what you need to do to combat that. Number 61, bow tie question. We have a few questions left. We'll finish at 73, but because of the case study, when you had it, you get 75. And let's care for a client who needs blood transfusion, red blood cell. You got to know transfusion therapy. The nurse review the data to prepare the client for care. Select condition the client is mostly experiencing, 2 action to take, and 2 parameters. This is the problem. Client has traumatic leg amputation. He was admitted to the medical surgical unit. Client was involved in a motor vehicle crash. No injury except the amputation. These are the vitals. Right leg amputated below knee, no active bleeding, compression dressings in place, and the doctor said give 2 units of PRBC. What did they at 8 o'clock? They used filtered white tubing prime with 0.9% normal saline. There's 20 gauge IV in the left arm. The blood type is verified with 2 nurses. Consent was obtained by the healthcare provider. 8:10. UAP measured the pre-transfusion vitals. Transfusion initiated. At 10 o'clock, these are the vitals. Temperature 100, heart rate 90, patient has chills, malaise, shortness of breath, hives, back pain, chest pain. At 11, same thing. No shortness of breath, but there's hives, back pain. At 10 o'clock, heart rate is at 10 o'clock, temperature is 100, heart rate of 90, patient has chills and malaise, but there's no shortness of breath, no hives, back pain, or chest pain. 11 o'clock, heart rate is going up, temperature is going up, patient has chills and malaise, there's still no shortness of breath, hives, back pain, chest pain. At 11 o'clock, temperature is 101, heart rate is 993, chills and malaise, there's no shortness of breath, hives, back pain. And these are things you pay attention. All the patient have is what? Temperature going up, and there's chills and malaise, but there's no shortness of breath, there's no hives, there's no back pain and chest pain. So pay attention. This is very important. They're getting blood, and all they have is tachycardia, low-grade temperature, chills, and malaise, but no shortness of breath, hives, back pain, and chest pain. Which condition the client is most experiencing? Acute hemolytic transfusion reaction, febrile non-hemolytic transfusion reaction, anaphylactic reaction, transfusion-associated circulatory overload. Strategy. There is no back pain, chest pain. It cannot be hemolytic. That is gone. There's no shortness of breath. There's no what? Anaphylactic reaction. There's no overload fluid in the heart failure. Therefore, we don't get circulatory overload. This is febrile non-hemolytic. If this is febrile non-hemolytic, what do? Stop the transfusion, give the patient acetaminophen, obtain blood and urine specimen, give them epinephrine. You know the condition. This is a bow tie question. What do you think? You give epinephrine if there's what? Allergic reaction. You obtain blood and urine specimen if there's hemolytic. Therefore, stop the transfusion, give the patient acetaminophen, and then you can resume. What are you going to monitor? Urine output, temperature, lung crackles, and heart rate. Of course, their urine output does not change. Their lung is fine. Just the temperature which is going up and their heart rate. That's all. That's your bow tie question. Number 62. And this is using social media. 2026 question. Using language about social media. Which action is appropriate regarding client confidentiality? If you worry about this text, then you worry yourself. Don't use your brain cells on that. These are the things, little things they added to the 2026. So if you're watching video on YouTube and you're freaking out about 2026, they're telling you all these things, ignore it. This is the question. If you go to the test plan, you say about social media etiquette, we know it. That means don't put patient information on social media. That's all. So which action is appropriate regarding client confidentiality? That's exactly language they use regarding social media. Go to the test plan. Posting a client story without using their name. Sharing a photo of the client after obtaining verbal consent. Discussing a client condition in the private online nursing group. Refraining from posting any de-identified client-related information online. All these things is what they talk about 2026. Should you worry? Which one shows client confidentiality? If you post without their name, you're still posting client information. That's the key. No information, whether their name is there or not. Even if they give you verbal consent, you need written consent. Verbal is not enough. They can change their mind. Let them write it and sign it. Therefore, don't post it. B is deceiving. Discussing a client condition in private online. Whether it's private online, don't share it. And this reframe all the three answers. Reframing from posting, even if it's de-identified, he has no name, social security, everything, still don't post it. That's all. And this is caring for a client with what? Intracranial pressure in place, which action by the nurse is appropriate to maintain accuracy of the monitoring device. This is one of the topics they put there, and this is why they emphasize that they want to ask you about ICP monitoring invasive device. And one of the ICP, what do you do to ensure accuracy of monitoring device? Repositioning the transducer at the level of the client heart, zero the transducer according to facility protocol, clamp the drainage system during position change, elevate the head of the bed to 90 degrees. If you've never seen ICP monitoring device question, this was right in the test plan about what specifically they're going to ask you. I put in this question. If you get it wrong, it's okay. We learn it. But pick the right answer. There's a way you can eliminate it. Somebody with the ICP, pick your answer. Let me show you. If you are monitoring ICP, you cannot be 90 degrees. Your head should be like 30. There's no way you can climb something that is helping drain. You can reposition the transducer, but not to the heart. The heart is too high, too low. You got to put it in the ear, tragus, the earlobe, and therefore zero the transducer according to the facility protocol. And that's the key fact. The next question is the same thing from the test plan. Which action by the nurse is appropriate to ensure accurate monitoring of intrauterine contraction device? They want you to know intrauterine contraction device. I put it in the question for you so that you can know everything about it. And then it's caring for a client in active labor having what? Intrauterine pressure catheter. Look at it. Intrauterine. That means I'm measuring pressure in the what? In the uterine system. What do I do? Reposition the client to the left lateral position every hour to ensure that the is accurate monitoring. Zero the IUPC to atmospheric pressure per facility protocol. Flush the catheter frequently to maintain patency. Apply external tocodynamometry for comparison. Stop the video, pick your answer, and let me know. But don't pick number 4 because you don't use external monitor when you have IUPC, intrauterine pressure catheter. You don't need anything externally. That means you double doing the thing. You don't need to flush it frequently. You zero it to atmospheric pressure. Turning the patient is okay, but it's not going to help with the monitoring device. And this is caring for multiple clients in emergency department. Which client require immediate implementation of droplet based on the symptoms? This is infectious control. There's no name there. You have to make a diagnosis of the condition. I have fever, cough, muscle cramp. Is it a droplet condition? Night sweat, weight loss, and coughing blood. I have paroxysmal cough and whooping sound. Is that sound like a droplet condition? I have vesicular rash on my trunk in different stages. I have fever, headache, swollen saliva, and difficulty chewing. Even if you don't know the name, the NCLEX can give you this condition. You have to figure it out. You don't have to pick everything. If it sounds like droplet, you pick it. Cough, fever, muscle ache, it look like flu, I'll pick it. But if I hear night sweat, weight loss, and coughing blood, that sounds like TB to me. I see paroxysmal cough and whooping, it's a whooping cough, I'll put droplet. Vesicular rash, it sounds like an airborne to me. If you have fever, headache, swelling, saliva, URI symptoms, and difficulty chewing, that's mumps. This may be hard, but pay attention for this type of question. Prepare for it so that you can pass your NCLEX. And this is the key. 60C. A nurse is reviewing the chart of a client who delivered 3 hours ago. Patient just delivered 3 hours ago. Which of the following factors increase the risk of postpartum hemorrhage? What will indicate that I'm going to bleed? The labor was 12 hours. The labor lasts less than 3 hours. The newborn weighs 8 pounds, 12 ounces, or 4,000 grams. Or the baby is small for gestational age. What are the risk factors for postpartum? This is maternity question. You pick your answer, don't get trapped. If you're small, there's no way the uterus get bigger. 8 pounds, 12 ounces, and 4,000 grams is the limit. Anything above that, that means it's a big baby. So this is good. Labor, more than 24 hours, you're going to bleed. But if you have labor less than 3 hours, that's precipitous labor. That means it's too fast. The uterus will develop atony, overcontraction, and you bleed. So this is a good question to trap you. By delivering precipitously will cause postpartum hemorrhage due to excessive contraction in a very short time. The charge nurse is observing staff members caring for newly admitted client diagnosed with what? Chickenpox, varicella. Which of the following action by the nurse require intervention? That means they're doing something wrong. Varicella, doing something wrong. Select or apply. Place the client in the private room with the positive air, pressure flow. Is that okay? Varicella, do they go to that room? The nurse wears surgical mask when entering to the client's room. Use standard precaution when handling the learning of the client with the chickenpox, varicella. Place a surgical mask on the client during transport. Place supplies of disposable face shield inside the client's room for dressing change. Don't get trapped. These answer choices are full of trap. Pay attention to full sentence and then pick the right answer. But the key word to answer question is what? Pick your answer and let me give it to you. You pick yours. I can tell you chickenpox is what? Airborne and what? Contact. I have airborne and contact. Of course, we're going to place the patient in what? Negative pressure room. Positive. This is wrong. I put positive airway pressure. Positive pressure airflow room. You pick it, you get wrong. Even though you saw pressure, you forget about the positive. The nurse is supposed to wear N95, not surgical mask. You should use contact precaution when you're touching their linen, not standard. When you're transporting the patient from their negative pressure room, they wear surgical mask. This is right. Supplies should never be placed in the patient room because it's contaminated. You should put it outside. Even though I put supply of disposable face shield inside the client's room for dressing change is contaminated. Therefore, there's only one answer. If you select these, you get 0. This is infectious control, adapting NCLEX way. So now, what is the question? Which of the following action by the nurse require intervention? Therefore, which one? Place the client in the private room, which is positive, is a problem. Where surgical mask in the room is a problem. Standard precaution is a problem. You should do what? Contact precaution. Placing a surgical mask on the client is much better when they're going out to transporting them. And supplies should never be placed. Therefore, these require intervention. That's what the question is asking. Initially, when I explained it to you, I'm telling you what it is, but now you have to go back and say, require intervention. This require intervention. And this is caring for postpartum client in the unit who is likely to be assessed first. 6 hours postpartum, he has a firm uterus, firm fundus, and a moderate lochia. 4 hours postpartum, boggy uterus, saturating pad every 30 minutes. 1 day postpartum, he has crampy and foul-smelling lochia. And the 2 days postpartum, reporting perineal pain every 6 to 10 in terms of a rate. Which one would you pick? Who would you want to see? Pick your answer, let me know. Who is in trouble? Look at it carefully. Select or apply. It does not apply yet. You have to pick one. I can tell you, saturating peripad every 30 minutes is a problem with the boogie uterus. I know you have crampy and foul-smelling lochia, but this is dangerous. You have perineal pain, is not that bad. A firm uterus is good. Saturating peripad with the boogie uterus, you bleeding, hemorrhage. And this has attended staff education program of angiotensin II receptor blockers. Which of the following medication should the nurse recognize as ARB? Arbisatin, Lensinopro, Lebedelol, Metadopa. Which one is what? A or B? Stop the video, pick your answer, and let me know. But I can tell you, anybody who have Satan as the last name is A or B. Lensinopro is ACE inhibitor. Lebedelol is a beta blocker. Metadopa is atypical antihypertensive. And NCLEX evaluating a client in the emergency department. Which of the following stool description require immediate evaluation? Trace of bright red blood present on the surface of the stool. There's a hard pallet-like stool. There's a melanic stool. There's a yellow loose stool. Which one should worry you when they describe their stool? You say, this is bad. Pick your answer. Let me know which one you concerned about. Yellow stool, it's not that bad, maybe infection. Melanic, you're bleeding. And pellet, constipation. Trace of bright red blood present on the surface. Don't pick it just because you see blood. You said trace a little bit. This is hemorrhage. And this is caring for a client diagnosed with acute pancreatitis. 3 more questions. Which of the following is most concerning? Prioritization 101. Test yourself with this question. How good is your prioritization? If you get it, high five. If not, go back and master it. Because I put a bunch of stuff here that will distract you. But I want you to focus on it. There's 9 out of 10 epigastric pain radiating towards the back. The abdomen is distended in the pancreatitis patient. Lipase is 1,000 and his blood glucose is 250 in a pancreatitis patient. The respiratory rate is 28. Oxygen saturation is 88 in pancreatitis patient. They have blue discoloration around the umbilicus in the pancreatitis patient. Which one should make you worry to be concerned about and pick it? Put your answer down and let me know. I can tell you this is a respiratory problem. They are having ARDS. Of course, discoloration around the umbilicus is killing sign, but bleeding, by airway, the breathing issue is a problem. This is suspected. This is suspected. Therefore, we worry about respiratory compromise more than that. 2 more questions. And this is a musculoskeletal. If you don't know, don't get trapped. I'll show you. And next is reinforcing teaching to a client following total knee replacement after the use of what? Continuous positive motion device, CPM device. Which of the following statement by the client indicate correct understanding of the purpose of the device? If they give you a device and you don't know what it is, go back to the name. It's continuous, you keep on going on. It's passive. What does that mean, passive? And then it's a motion. The device will help prevent blood clot. The device will keep my joint moving to prevent stiffness and promote flexion. The device will help build strength in my leg. The device is mainly used to reduce my pain. What do you think? Stop the video, pick your answer, and let me know. But test-taking strategy. Passive, I'm not doing anything. Motion is moving me so that I don't have stiffness. Therefore, strength is when you move. You get strength when you move your muscle against resistance. There's no movement here. It does not prevent clot. That's not why you use it. Clot is usually give you SCDs or medication. It's not reducing your pain. It's preventing stiffness. 72 questions. Next question is the last one. Thank you for getting here. Thank you for supporting the channel. If you like this video, share it with your friends. And if you want to become a member of the channel, check out Dr. NCLEX. You get more content like that. And let's provide care for a client prescribed what? Finasteride. The next, understand that the therapeutic effect of the medication is evident by what? Why am I giving you? And what is the good effect are you going to see? Increased libido, increased sustained erection, decrease in urinary retention, increase in prostate size. Do you know finasteride pharmacology? Renal pharmacology. This medication is used to shrink what? Your prostate. And using prostate and BPH. If you shrink it, fluid will flow, urine will empty easily, and therefore It does not increase your prostate, decreases. It will decrease urinary retention because more urine flowing. It causes what? Erectile dysfunction and decreased libido. 85 question. English practice question. English review question. Test taking strategy, mastered. All the things you need to know for NCLEX 2026 are incorporated. I hope you get over 65 and good luck in your exams.